We're going to start here. Good morning. And it looks like we're having just a little slower start this morning, including my own, but not intentional by any means. Couple things at the top of the hour, and welcome to the intersection where faith, community, and civic leaders come together, learn together, move together, act together, and create a better city and county together. So it's good to see you this morning. We're going to take, of course, a little time for announcements coming up in our future, and we'll be putting things in chat as well, links. But May is Mental Health Month, and so we're really focusing on that now. This is the beginning of a series. We started it last week with Dr. Junda Woo, the medical director, and she gave us an update on the community health implementation plan. And today, Jessie Higgins with Metro Health, our chief mental health officer with the city, is going to be giving a report on youth and mental health. But before we go there, in that whole pattern, May 21st, and again, we'll put that in chat, the next Sacred Action Lab will be happening on the 21st in partnership with NAMI. And so we want to make sure we already got a significant number of people coming to that. I believe off the top of my head, that's going to be held at Covenant Presbyterian. And maybe Doug can even go like this, but that will be coming. Also, the Bear County CHCS conference is May 29th. Other people can also go like this and assure my memory that I'm talking clean on that. So we'll want to be marking our calendars for these things and showing up. We know how important it is, not just for our weekly gatherings where we get these really tight briefings that can be utilized with staff and with teams and with congregations, but that we're also meeting in person. And all of this is very intentional to get us really moving forward as a community. And right now, we're really focusing on mental health. We would be doing other things in the future, but this one's critical. So we're learning and we're growing into that strong community. Plan is also to send these out to our elected officials, both city and county, and staffs, and across both of those in ways for them to also hear what the community is working with and how we're moving forward. So let's just keep that all in mind. And again, we'll put those links in chat. We're just a little slow in folks showing up this morning. Any other announcements that somebody would like to make? We have one further down the road. I'm going to go ahead and announce it so you keep putting it on your calendar. Pathways to Hope is our citywide annual mental health and wellness conference, August 28th and 29th. August 28th and 29th. Please put all of these on your calendar, not only for you to show up, and even if you're out of town for some reason, these are things that you can encourage other people to come to, your own leadership, your own congregation, your organization, your team. Start building in those directions. One of the things that we had happen at the last roundtable, sacred roundtable, is that we started to have teams of people working on efforts show up and work together during that session. So I really invite you and encourage you to think that way. We learn a few in-depth concepts, but also how to take action more efficiently and effectively during those times. And then your teams can get to work. So you can really take advantage and leverage some of your efforts during those times. So we're going to list those all again in chat, because we know that chat doesn't really, if somebody comes in late, then they kind of miss it. So we're going to go ahead and do that. Billy, your screen is upside down on your shirt. I just want you to know. I don't know what's happening in Billy's world, but
Camera
upside down and
issues
over.
here.
you're having issues, all right. That's a really, yeah.
Wow, I'm not even
Anyway,
sure. Not even sure what it's taking a picture of now. Wow, that's pretty weird.
yeah, it's pretty weird. He's just trying to wake us up this morning. I appreciate that, Billy. Um,
So I guess I do have an
any other?
announcement then.
Okay,
We will be
great.
using the AI companion as a part of Zoom for note taking and summarizing. And we will post those notes with the video on the blog. And so we'll not be letting other AI tools in to summarize. We'll be putting the notes on the blog.
Oh, so when people like sign in their AI, you won't be accepting that sign
I'll
in.
be
Do I
declining
understand that?
those. Yes.
Okay. All right. Um, that'll impact our numbers. I've noticed that recently, but that's great in that we're taking those notes for everybody as well. Let's see what time it is. We got a few more in here. It's 8:06. I think we're going to go ahead and start. Jesse, thank you so much. I know this was kind of short notice, but we made it. And as I understand it too, Jesse recently gave this report. So we try to do that at the intersection, that to utilize reports that have been prepared for our city council or for our county commissioners, so that our community is receiving the same reports as our leadership. And that's also important for your leadership, whoever that might be. Um, Send these leaks to them. I wouldn't send a bunch, like one at a time or something, one that's really important that you think to the work that's happening in your congregation or organization. And let's train up our leadership to be in line with our community that's leading, on the ground. So thank you, Jesse. Perfect follow through with Dr. Woo last week, and I hand it over to you.
Yeah, thank you, Anne. It's good to be with you all again. Anne's right. My name is Jessie Higgins. I'm the Chief Mental Health Officer for the City of San Antonio. And Anne's right. I gave this presentation on Tuesday morning to our council committee that's called the Educational Opportunities Committee. It's a new committee this year, and it's really been fun. As we probably all are aware, last summer, we had a lot of turnover in city council and obviously in the mayor's office. And that happened just naturally, like term limits and things like that. And it's been fun. I'm almost completing my fourth year working at the city. And so we've had the opportunity to really re-educate and tell them more about what we do and what the city's been doing. And so you'll see this presentation is almost more of like it's current work, but it's also an overview of our past work. I wanted to be able to show council how this Office of Mental Health and Resilience that I head up came about, and really where we started because of COVID, really, and where we're going. And so it's important, I think, for us, all of us to understand, for the community to understand, and for our mayor and council to understand, we started in this area or in this time that had a lot of funding, a lot of money came in 2020, 2021, 2022 through COVID funding, and how we're making it work as those funds have been depleted, they've been spent down, they were one-time funds, and then as we're going into even a budget deficit. And so that was kind of one of the points of my presentation is we're going to look at an overview of what we've done, and then I really divide the work that we do in youth mental health in three areas. So school-based mental health services, the Bay Area School Safety and Mental Health Summit, and advocacy with our partners. And so some of those partners are you, some of you are intimately aware, some of you will be hearing about this stuff for the first time, but I'm really excited to show all of this to you today. So starting sort of, like I said, coming out of COVID, I mean, Metro Health has a history of folding mental health interventions and programs and contracts into its work. But this current iteration of mental health initiatives really began in 2021 out of COVID. There was a lot of money coming out of the federal government. The CDC did a big grant to health departments called the Health Disparities Grant that was meant to address disparities, inequities, things that were exacerbated and really made obvious to everyone through COVID. And so Metro Health included two mental health contracts in this application. And we got those started in 2021. And then in the spring of 2022, we launched the first teen mental health survey. Spoiler alert, the third teen mental health survey is open right now for responses. I'm definitely going to ask Anne to send that out to all of you. If you've got 12 to 19-year-olds that live anywhere in Bexar County, we would love their responses. But skipping ahead, I'm not being faithful to my own timeline, but it's really important that we highlight that. In June of 22, the Office of Mental Health and Resilience was launched, which means I was hired. And I started in June of 2022 in the health department. And then we immediately jumped into community input sessions and RFPs for our ARPA contracts. ARPA was the American Rescue Plan Act, which was a huge amount of funding that was given to city, county, and state governments. And we put a lot of that money out into the community for different projects, but mental health was definitely one of them. And we ended up with 20 youth mental health contracts across the 2 years that we had funding. They started in March and August of 2023 and then ended in February and July of 2025. In October of 2023, we saw those school-based mental health contracts get moved from that grant funding to the general fund, which if you know about the city's budget, the better, the more stable funding would be to get something on the general fund and not rely on outside grant sources. And so this was a big dedication of city council that we were wanting to make this more, not permanent, it's as funding allows, but a more permanent fixture in the city's budget. And so then in spring of 2024, we launched the second teen mental health survey. This survey, I should say, is done by the youth-led groups, the Project Worth Teen Ambassadors, and the San Antonio Youth Commission. It's a collaboration with DHS and Metro Health and those groups. And it was great because in 2024, we actually saw that the teen mental health in San Antonio was a little bit better. Slight increases in some key areas, but good to see that we saw some resiliency from teens. And you know, coming 2022 still felt very isolated and still COVID, and 2024 seeing a little bit better increases. In November of 2024, we hosted the first annual Bay Area School Safety and Mental Health Summit. We'll talk more about that in some later slides. For fiscal year 26, council allocated an additional $150,000 for those school-based mental health services, which was huge, really important dedication there. And then in November of last year, we hosted the second annual Bay Area School Safety and Mental Health Summit. As I mentioned, we currently have the third mental health survey, our teen mental health survey open, and then later this year in October, we'll have the third annual Bay Area School Safety and Mental Health Summit. And so we're going to talk more about each one of these things, but really important to kind of see how we started these initiatives, and then as funding has changed, like what we're able to sustain and what we're keeping going. So this is just a little review of our ARPA contracts. So we have, in addition to these youth mental health contracts, we also had two that provided diagnostic services to children with intellectual and developmental disabilities, and two for adult harm reduction. So for these youth mental health contracts, we had 20 total, and for a total of $15.75 million. It all ended last year. And through these contracts, more than 6,000 kids were served in individual or group therapy. And of those that had 4 or more sessions, 52 saw a decrease in symptoms and 44 saw an increase in well-being. And we only did those assessments at the first and fourth session. And so just after, and they got more sessions after that if they needed them or if that was their treatment plan with their therapist. But just to see those outcomes was really encouraging. And we were really proud of all of the providers, 20 providers that did this level of data tracking and worked with kids to show these numbers. So currently, like I said, we have 2 school-based mental health service contracts. The communities and schools serves 100 youth that have been impacted by traumatic experiences through counseling, case management, and basic needs assistance. And they're in East Central, Northeast, North Side, San Antonio, South San, and Southside ISD. And the Meadows Mental Health Collaborative, the Meadows Mental Health Policy Institute serves as a backbone for the Mobile Mental Health Collaborative, and the partners are Rise Recovery. Sorry, I'm tripping over my words. Rise Recovery, Charity, Clarity Child Guidance Center, Family Service Endeavors, and Hoven. And this collaborative serves 550 students, district staff, and family, and that's total, including all of their funding sources. And they do that through counseling, case management services, drug and alcohol intervention, psychiatry, and a youth leadership program. And they're in Edgewood, Harlandale, Judson, and San Antonio ISD. And so I'm happy that we've got a good spread of services across a good number of our districts in our city. The landscape of school-based services is going to change this summer. This summer is when our contracts for ARPA went for 2 years. Bexar County's contracts for ARPA funds went for 3 years, and so those funds will end this summer. And so next school year, when kids go to school, they'll have less services available to them. And so anything that we can do to preserve that funding, like we've got these contracts on the general fund, is really important. And so yeah, we're working with all of our community partners and Bexar County to monitor the impact of the funding ending and to do anything we can to enhance partnerships and create referral pathways. Like we're trying to connect people in groups that maybe haven't been connected before and trying to make those connections before maybe symptoms get worse and trying to make sure that people know how to get into services. So one of the things that's interesting about my job is that I have the privilege to go to a lot of meetings, and I mean that very sincerely. Like I love hearing about the work. I like getting to meet people. Our system of care still is very relationship based, which means that it does matter who you know and what you know about what's going on and how to connect people into things like that. And so a few years ago, I was in a city council meeting where we were talking about how the police department was going to help prevent a mass casualty event on a school. And the police department certainly is trained and works with school districts, law enforcement, and we are well equipped to make sure that if something starts on a school campus, that the police department will address it. But really what the aim of those questions ended up being were about prevention and how do we keep kids from wanting to walk into their schools and commit an act of mass violence. And so of course that comes down to mental health. And so I was just thinking like so many of the rooms that I get to be in are not always talking and not always connecting. And so we really need to bring together the right people in one space to start talking, to connect, and to see what we're all doing. And so in 2024, we hosted the first annual Bexar Area School Safety and Mental Health Summit. This has been a collaborative effort with the city, Bexar County, Region 20, and communities and schools. And at the first summit, we had over 150 people in attendance. These people represented school districts and charter schools, nonprofits, hospitals, philanthropy, law enforcement, criminal justice, elected officials, the Texas School Safety Center, HHSC, the Office of Homeland Security, the FBI, and the Secret Service. And so we had the right people in the room. We had the higher level. I mean, when you think about a summit, it's really trying to get the leadership of these rooms. That sometimes leadership can be even more siloed because they're so busy running their own shops that they don't often get out and able to talk to others. And we really wanted to help people understand that mental health of school-age children is a public health priority. All of us have a stake in this. It's not just school districts. It's not just law enforcement. It's the whole community that needs to pay attention to this. We wanted to strengthen school safety by supporting a comprehensive system of care, which includes mental health. And then we wanted to be able to identify next steps, like what can we do out of this? And so the impact of this day continues to have ripple effects in a good way. Um, One of the steps identified was the legislature advocacy days. So if like you think about the fall of 2024, the 89th session was in the winter and spring of 2025. And so we were able to go, Assistant uh, Chief Salome, he's in the San Antonio Police Department, and I were able to go with a whole group of people and speak to the legislature in February of 2025 and talk about how schools and community can support both physical safety and psychological safety to decrease the risk of threats and increase wellness in schools. And so then last year, we hosted the second annual Bear Area School Safety and Mental Health Summit. We're kind of trading off with the county on who's the lead. So last year, the county was the lead. Um, Again, we had over 150 attendees. We brought in student voice this time through our plenary speaker and through a panel. It was really important. And again, some of the leadership in these places doesn't always get to hear from students. I mean, schools do, I think, pretty regularly, but I don't know that like nonprofit leadership always does. Hospital leadership certainly isn't like in a room where they're hearing from 16-year-olds. Law enforcement, all of these things. And so that was really important. We did a policy review because it was last fall. So we did a policy review of the 89th legislature. And we looked at like some new topics included like vaping, substance use, suicide data. And out of that summit, we heard concerns about Senate Bill 12 and House Bill 2, which I'll talk about in just a minute. Um, and then we're really proud of this year. We're going to be hosting the third annual Bay Area School Safety and Mental Health Summit in October. We are continuing to build on the ongoing work and the momentum we feel in the community. We know that we can't have safe schools without all of us working together to support students, teachers, and leadership. Like we just know that that's where safety is going to come from, is from supported well-being of all of those entities. So, like I said, we've been kind of transitioned into doing a lot of advocacy work. And so Senate Bill 12 was passed in the 89th legislature. It was it's kind of called the Parents' Bill of Rights, and it went into effect on September 1st of last year. And it changed how schools must obtain parental consent for health, for like all health related services. So mental health, physical health. And so what we noticed was that this law has caused some confusion for schools and for school-based mental health services. The implementation wasn't clear about how districts had to roll it out. It wasn't exactly clear what health-related services were. And so by that happened September 1st of last year. Well, by the time the summit came around at the beginning of November, school districts, counseling providers, and hospitals were already seeing changes in how children were receiving services and then the health of the students overall. And so in January, we started collecting data from providers and hospitals, and we were able to see a decrease in utilization of school-based services and an increase in hospitalizations, both through walk-ins and emergency detentions. And so that's, an issue. And so a group of us have been meeting with some of our representatives to show the data and explain the issues that we're feeling locally. So this is really for TEA, the Texas Education Agency, to give clarification on how this can be implemented. We don't expect this to go away. And honestly, it's a good law. Like it raises parents to be more central in the care of their students, or their kids, even if they're at school. But I don't think the intended consequence was to be a barrier to care that was needed. And so we're working to show the data and show the impact. And last on this slide, the top picture here is a group of us from San Antonio and Bexar County that attended a policy summit in Austin in December. And so I'm really proud of this picture because the year before, I think there was only like 6 of us there. And so through this summit, we're elevating the issues of the attendees of the summit, but also we're making policy issues easier to understand so that people understand where their voice is and where and how policy is impacting them. So the last thing that I have here is that some encouraging thing that we're working on is is with working with partners on the school safety allotment or House Bill 2. So after the first summit, the HEBOT Foundation came to us, Metro Health and SAPD, to better understand how local law enforcement and the Fusion Center work with schools to identify threats. So through the last 2 years, we've monitored the progress, and we're happy to see that the 89th legislature actually funded the school safety allotment, and then importantly allows for these funds to be used for both physical and psychological safety. So this is school hardening, but this can also be mental health interventions. And so it was important that it get funded, and it was important that it allows the school to use it for either. And so that's really huge. So starting in February of this year, we, Metro Health and SAPD, worked with district leaders, nonprofits, and policy experts on a blueprint. And these are some snippets from the blueprint for schools to understand existing funding streams, identify opportunities, build cases for investment, and navigate the systems that shape how schools are funded. And also, it will support district leaders, policymakers, and partners in strengthening physical and psychological safety through funding strategies, collaboration, and long-term planning. And so, we're trying to help schools build the case that healthy students mean a healthy workforce, school safety is public safety, and that the healthier a student is, the safer they are. And so, we're very excited for this initiative. Once it gets finalized, we will get this to Anne so that you guys all have a digital copy of the blueprint. It's long, but we're trying to get it into as many interested parties' hands as possible. And so lastly, what's next? Like I said, we're promoting the third Teen Mental Health Survey. It closes on April 10th. We're continuing our advocacy work. We're in the interim charges part and the sunset part of the off year. And then we're gearing up for the 90th session, which will be starting in the next winter. And then we're still working with partners to strengthen those referral pathways as the funding diminishes. And we're planning the third Bear Area School Safety and Mental Health Summit. So thank you so much for letting me present. I saw lots of things in the chat, but I couldn't click over, so I'll check that out, or I'm not sure if you guys have questions.
Well, first of all, Jessie, what I really appreciate about this briefing is the multi layers of the efforts, right? From the summit and gathering people together, but also doing the important advocacy work, as well as the financial update and how that all works. The more we build, and we all know the importance of collaboration and working together and how critical that is to the efforts that we're trying to move forward. So it's really great, even in your briefing, that we're seeing that more and more about how all of this works together and how critical that is. Couple questions that I had, like if the community wanted to be more involved, right? Somebody here that's listening and's gotten inspired, and besides me saying, make sure you come to the next action lab, make sure you come to that conference, that's I think one of the best ways. But what could they do from your perspective?
I think that's a good question. So it's hard because sometimes I'm working um so like specifically with like the leaders of these organizations. But I think that one thing that would be important is that if you have a child that's in school, and I don't just mean public schools, this is an issue. The school safety and mental health is an issue that affects everyone. It affects charter schools and private schools exactly the same way. And unfortunately, we've seen that across. I would talk to your school district or your school leadership about what they are doing and how you can support them. A lot of these things need to happen, or not need to happen, but the issues are also raised internally in school leadership, right? School boards are elected, and they make a lot of budgetary decisions and policy decisions. They need to hear from parents who they're elected by, or their community who they're elected by, what their priorities are. I think that paying attention to the laws that are passed and how they affect schools. I mean, a lot of it has to do with our advocacy. I mean, we all have a voice, and we all, especially in local and state elections, our votes are really important. And so, paying attention to these type of policies and how the people that you're voting for are going to vote on them, I think is important. But yeah, I always point people back to if you're interested in school issues, like go back to the schools. Schools themselves, there's a lot of room for advocacy in schools themselves, with boards, with PTAs and things like that.
It makes me think too about, um, I love that idea, go to your school board, go to your school district and connect there and how can we help? It makes me think of all that research that tells us too about young people who grow up like the rest of us, right? They have a greater chance for not just survival, but thriving in the world if they have a significant adult who cares. So I
Right.
would attach to that,
Mhm.
if you know a young person, one young person, right? It's all it takes, and it makes a huge difference. And love them, mentor them, support them, which could mean a lot of different things, and not just like schoolwork, but that's
Right.
one area, right?
Right.
So those are two really, you know, out of a collaboration kind of setting that you could do in the world to make a difference and really have that ripple effect. Which also makes me think, Jess, what do these things, like what's going on with the absenteeism within schools, and what's our tweak there that we could be helping more with that?
Yeah, I am not the absenteeism expert, but I do know that, and you talked about mentoring, and that's a perfect example. And there are, I mean, if you went to, and again, keeping it as local as possible, if you went to a school that was close to you and said, I'd like to mentor, they'd probably be able to connect you with with a program that would allow you to do that, right? And would train you and make sure, Big Brothers, Big Sisters is one that comes to mind, but there are other ones that do that as well. Um, I know that, I mean, we have in our blueprint, we had research about how mental health supports have directly correlated to better attendance, which is still how schools are funded in Texas, is through attendance days. And so paying for investing in mental health supports helps the school get more funding because it helps attendance, which is also good for kids that they're in school. And so we are worried about seeing dropout rates increase and absenteeism increase with these mental health supports that have been around for a few years now, dropping off.
Hmm. Yeah. Others, I want to open it up. Are there other
I see
comments or questions?
Peter has his
Peter's
hand
hand
up.
up. Peter.
Thank you, and thank you, Jesse. And I'm sorry my camera's not working this morning, so I can't come on and have my camera on. But I'm working with CHESS, right, the Center for Health Empowerment in South Texas, and addressing the disparities in the South. And I was really impressed with what the ARPA funding did with providing the mental health resources to the youth through contracts. And I think I saw like 6,000 clients went through, and that you had the data to kind of show how they were impacted. Interested in the data that would show across the city the participation, and maybe it's by school districts, because I'm kind of driving toward how you identify, and you said, it's about relationships, right? Who you connect with, and those entities that are working on the ground, that are doing the best work of outreach, are the ones that are going to draw the most. NAMI's done a great job of breaking down that stigmatism in working in communities, but getting it into the right communities to break that down where people will do the outreach and connect. I think that'd be very useful for the work we're doing with Chess, to be able to identify those nonprofits that are really doing this. Top of mind, communities and schools. I'm almost sure that's one that's going to be at the top, but just in the southern sector, who's doing that work? And if you don't have an answer right now, I'm good, but we can get back with it, because there's some kind of drive down local like that.
Yeah, Peter,
Mm.
send me an email. I know you have my email. We tried to invest our ARPA investments. We didn't look at school districts, we looked at council districts. But we tried to address somewhere or invest those monies where we knew that there was greater need. And so I can probably give you some of that. I Communities in Schools is a great organization, and they go where there's need, and they have a lot of, they're kind of widespread. That's important. And so, yeah, but there are some other more, I don't know, like sort of neighborhood-based nonprofits that did good work through the ARPA contracts as well. And if you can send me an email and I can help you with that.
Yeah, thank you so much. I appreciate it. And just did identify mental health and suicide as the number two, right behind cardiovascular as far as the prioritization. So I was really happy to hear that. So just encouraging to see that the work's already kind of been laid out. Thank you.
Mhm.
Yeah, you're welcome.
And thank you, Peter, for modeling, you know, community stepping up and being smart about this, right? We need more of that. Need more of that because that's our continuity of care is that the community knows this information as well. Melanie, your hand's up.
Yes, Jesse, thank you for this amazing presentation. I have worked in the schools for 29 years, and it's near and dear to my heart and that mental health. And I want to tell you that I was at a conference, a couple weeks ago where, and there's others on this call that correct me, but depressed students have their first suicidal ideation at the age of 9. That is very scary. We need to keep up that good work in the mental health department because it works. And just another, I'm the stat girl. I'm kind of a nerd. I'm sorry, but 19% of Texas children are chronically absent from school. So we've got to figure out how to get those seats in the seats, right? And so that again circles back to that mental health piece. So thank you, Jesse. Thank you.
You're welcome. And that I'm really proud of the blueprint that we worked on through the H.E. Butt Foundation because it really tries to build that case. And it's in plain language, but it is geared towards district leadership, knowing that they're the ones that need to like understand what's happening in their own district and how to talk to their school boards and how school boards and they talk to legislatures and things like that. But and we have some great case studies from East Central ISD, from Communities in Schools, from SAPD that really show how when we invest here, it pays off over here. And yeah, and all of that sounds, a little transactional, and unfortunately it is. It takes money. Like when we say services cost money, right? They cost someone's salary, they cost money. Um, but we have also seen like it's better for kids to be in school. It's better when kids graduate school. It's better when kids are connected to other kids and connected to healthy adults and things like that. And so yeah, it all goes together.
And the data helps us. I can remember not that far back, but especially within like the faith and religious community, like we don't want to be numbers, right? We don't because people aren't numbers. But the numbers do tell us things and help to affirm what's working so that we can focus our efforts in ways that we can reach the most, right? So it's both and. It's both and. It's not about making people numbers. They're not. We're talking about human care here. But the numbers can tell us what works best with humans. So, and I really appreciate where our community and leadership have come in that regard of this humanness that we're about, but also the things that work and how the data speaks to us and can help instruct us in moving forward. Jesse, we've gone a little long for you. I'm so sorry. I meant to say at 8:30 if you were okay with staying longer, but because we went long, thank you for being with us, Jesse. Thank you for the work that you're doing every day. We appreciate you. And if you need anything in any way that we can help as a community, just let us know, let me know, and we'll get the word out and we'll move things forward. So as best we can. Anyway, thank you all.
I appreciate you, Anne. I see that someone, Araceli, put
Oh,
the
sorry.
teen mental health survey in the chat. So for everyone, please get that to your 12 to 19-year-olds. And I love getting to present to you all. I love, I feel your support. I hope you know that you have my support. I know we're all doing great work in the community.
Thank you all. I did put into chat, we've got a really good At the Intersection again next week. It's a global book that's in multiple languages, written by one of our own. And so I hope you come next week, about breaking the stigma, and also very human story about data, but also someone's sister. So thank you all for being here. Have great weekends, and we'll see you next week at the Intersection.
Brilliant.